I'm Deb, and we're here in Nanaimo. And we're at the Kidney Care and Transplant Clinic, and we're just about to go inside, so don't go anywhere because we're going to get a great bird's eye view into what happens for kidney patients, both pre and post-transplant. So I am here with Kiyomi, Team Lead Nurse Clinician here at the clinic. Thank you so much for Kiyomi for taking a few minutes out of your busy day to join us. And so Kiyomi, can you talk about your role here at the clinic?
So we start from before transplant to after transplant. So what I mean by before transplant is basically I get referral from a kidney doctor and make a patient folder and send a referral to Vancouver. And in Vancouver, there are two transplant centers at St. Paul's Hospital and Vancouver General Hospital. So we make a referral to one of those transplant centers.
And those are the two centers in the province that do transplants. And they're the only two, correct?
Yes.
Right. So, so you are in charge of the referral process.
Yes. We basically do is make paper documents and then also make sure all the required tests are done, blood work and chest x-ray, ECG, and all different kind of medical tests are done before patients are seen in Vancouver for assessment.
Can you talk a little bit about the other roles that you have here at the clinic?
I usually do like a telephone consult, and then I explain to the patient what they expect step by step. And then sometimes I do follow up if they have any issues or if they need any support. Some patients have a difficulty getting even to Vancouver. So we make sure transportation, accommodation is secured.
The Kidney Foundation's Kidney Suites provide we call it kind of worry-free accommodation at little or no cost to the patient. So again, is that something that you talk about with your patients here at the clinic?
So when our patients goes to Vancouver for transplant, they have to stay in Vancouver area for 2 to 3 months after transplant, and then of course they don't have place to stay. So most of our patients from the island stay in kidney suites.
The Kidney Foundation's Kidney Suites.
Yes,
oh, that's fantastic.
Yes, yeah, and then because that's one of the concerns most of the patients who are going to have a transplant patient has, where I'm going to stay after I'm discharged from hospital. That's one of the biggest concerns they have, because not so many people can afford to stay in a hotel, especially in Vancouver, for 3 months.
That's exactly why we have them, is to provide that sort of worry-free accommodation for post-transplant kidney patients, and that they can access one of our suites at little or no cost.
Yeah. And not only a patient, but also support person, a family member can stay.
And we actually have a family suite, and,
yes,
and one designated for children as well.
Right, yeah. So that's a huge help for our patients.